I'm Nancy Way, and I'm the Medical Director for Clinical Informatics.
And hi, I'm Greg Lowe. I'm the Program Director for the MGPO's Pharmacy Program.
All right, and we're here today to talk about medication safety. Medication safety is one of the top quality and safety priorities for the hospital. With the introduction of both provider electronic prescribing as well as pharmacy, retail pharmacy systems, electronic systems, it is important to understand how a patient's medication list may differ from the clinic to pharmacy to home.
So Nancy, what should we think about with what we're seeing with the Epic medication list?
So the Epic medication list is a combination of medication orders indicated by the house icon that gets sent to the retail pharmacies, as well as patient-reported medications that might have been prescribed elsewhere outside of the partner system, and any over-the-counter supplements that they may be taking. So when reviewing and reconciling these the patient's medication list, it is important to pay attention to these icons and be careful with the decisions to remove or discontinue medications on the patient's medication list, as it can result in discontinuing the active order in prescriptions. Since September, the removal or discontinuation of these medication orders with the house icon from the patient's medication list sends a cancel RX notification electronically to the retail pharmacy so that they know that a change has been made and can void the remaining refills on the prescription and prevent further fills. So, now that you know about the medication list in Epic, how does this differ, Greg, with the pharmacy medication list?
Sure, so pharmacies are looking at something quite different out in the community. So they're looking at the prescriptions that they either received an order for locally or that they filled locally. They may be able to see other prescriptions within that same chain, but they can't see prescriptions filled at other pharmacies. And so they're getting an increasingly fractured picture as more and more patients are using mail order. Most of the pharmacies have some way to enter over-the-counter drugs as well, but frequently that doesn't happen. So a lot of the times that's missing. So a real advantage is that they can see actual pharmacy fills, but there are still some big gaps there.
Oh. So what are ways of communicating with the pharmacy in order to ensure that our medication lists are in sync?
So there's three things I think of there. One is that there's a comments for the pharmacy field in Epic, and that's helpful for notes that may not be too important, but are kind of good housekeeping notes. The challenge with that field is different pharmacy systems present that comment in different places, and so it's not very reliable. The second thing that's more reliable is you can put it in the notes field of the prescription itself, but the risk there is a lot of pharmacies will put that directly on the prescription label, which may not be appropriate. So the last option is simply to call the pharmacy. If it's something complex, I would specifically mention that you want to speak with one of the pharmacists. So what are medications that are of particular concern that we would want to make sure we communicate with the pharmacist?
So I think communication with the pharmacy and the pharmacist around high-risk medications such as oral chemotherapeutic agents, antithrombotic agents and antiplatelet agents, insulin and sulfonylurea hypoglycemics, as well as controlled substances like opioids and Adderall and anti-epileptic drugs. Any changes made to those should warrant a direct communication with the pharmacist in the mechanisms in which you just described.
Great, thank you.
Thank you.